For people with stress-related disorders, the physical damage can manifest itself through a host of medical conditions and symptoms, such as tension headaches, migraine headaches, irritable bowel syndrome, and fatigue. Anxiety disorders are different from everyday stress and anxiety. They are medical conditions with specific symptoms. In some cases, they may be caused by a chemical imbalance in the brain. The two most common types are panic disorder and generalized anxiety disorder. Coral Letness experiences symptoms of panic disorder. They come on suddenly and unexpectedly and last only a few minutes.
When I have an anxiety attack, I feel like I have ice water in my veins. I feel like I need to vomit. I have diarrhea. My heart beats fast. My palms sweat. And just this overwhelming fear that you're going to die or go crazy.
Because the symptoms are so severe and seem to come on out of the blue, people with panic disorder are often afraid they're having a heart attack or going crazy. Fearing another attack, they may avoid normal everyday activities such as driving, grocery shopping, or even leaving the house. Generalized anxiety disorder can also interfere with one's ability to function. But unlike panic disorder, in which each episode tends to be relatively brief, generalized anxiety disorder tends to be chronic or ongoing. Susan Sechrist, diagnosed with generalized anxiety disorder, went to her doctor with a variety of symptoms.
Heart palpitations, chest pain, some nausea, dizziness, really basic symptoms, but they were very chronic. It wasn't like in one period all of a sudden I started feeling all of these things. It would be I'd go home, I'd feel tired, I'd feel my heart beating a little faster than it should.
Most importantly, people with generalized anxiety disorder have unrealistic and excessive worries about everyday issues. Being diagnosed with a stress-related disorder or anxiety disorder is nothing to feel ashamed or embarrassed about. It's a very common problem, and it's not a sign of weakness or mental instability. Being honest and open with your doctor about your feelings gives him or her the information needed to determine what happens next.
Report 2. What happens next?
The severity of your condition and your overall health will determine what happens next after the diagnosis. The truth is, some things in your day-to-day life may change. You will need to take personal responsibility for scheduling doctor's appointments or remembering treatment plans, and you will want to know what may lie ahead for you.
It was hard for me to ask for help for the stress and anxiety I was going through because I felt that I could tough it out. Well, I couldn't tough it out. I needed to ask for the help to get through it.
In many cases, a generalist physician, an internist or family doctor, will be able to help you deal with the underlying cause of your stress. And the doctor will want to continue treating any medical problems brought on or made worse by stress or anxiety.
How are you doing with the stress and the difficulties you have with breathing?
It's much better. I still have trouble with coughing in the morning and in the evening, the bronchospasms.
Right. Family physicians are often the first doctors that patients seek help from when they're having stress and anxiety. We will be the first ones they see because they've known us for years and they trust us and they've come to see us for all their other problems.
The doctor may perform a thorough physical exam to identify any other illnesses that could be causing symptoms. In addition, he or she may recommend medications or lifestyle changes to help reduce the stress in your life. In some cases, you may be referred to a mental health professional. This person works closely with your doctor, so your stress and medical problems can be treated at the same time.
And we work together as a team to take care of these patients. And that's usually worked out very well for these patients. They like me to stay involved with this team of other providers they don't know as well.
Mental health professionals on the team may include a psychiatrist who is a medical doctor and can prescribe medications, a clinical psychologist who has a PhD, or a social worker or a nurse who has a master's degree. No matter whom you're seeing, it may be helpful to include family members in the treatment process.
It's very important for patients to share their fears and their concerns and their symptoms with their family, particularly their spouse. We have found that when spouses are engaged in the assessment and the treatment and learn more about it along with the individual who's suffering from the disorder, that over the long term these people do a lot better.
Hi now. How are you?
Well, I'm not completely all right, or I wouldn't be here.
With anxiety.
Nell Hill suffers from generalized anxiety disorder. Once she and her family understood her disorder, it made it easier for everyone to handle, including her husband, Doug.
And I felt 100% better when I finally found out it wasn't my fault. I kept thinking, geez, I'm doing something wrong here.
Some spouses keep their spouse sick by questioning them and making them feel bad about it. But Doug was really supportive, and that probably helped speed my recovery as much as the medicine or the therapy or, whatever.
Talking honestly about her own fears has also helped Nell's son openly discuss his problems with anxiety attacks.
I feel kind of hard breathing during the middle.
And what do you do when you feel that way?
I just, like what you said, just let it pass.
Let it go.
I just
That's the way to do it. Although I wish he didn't have it, we spend a lot of time. I help him, and he helps me a great deal. And I feel like, therefore, he won't suffer or have to go through what I did.
Finding the treatment that's right for you and gaining the support of friends and family are the first steps in getting help. We'll discuss specific treatment strategies in our next report.
Report 3. Treatment and Management.
Your doctor will advise you on what treatment or management approach is recommended for you. It is important that once you have decided on a strategy with your doctor, that you do your best to stick to it. Make sure to take notes on how your treatment seems to be working for you, and let your doctor know how you feel about your progress.